Hey guys, welcome back to the Sexytime podcast. I'm Belle.
And I'm Ava, and today we're talking about all things fertility.
That's right. And we have our guest, Doc Ednalyn Ong-Jao, the medical director of Kato Fertility Clinic in QC. First of all, why is the name Kato?
Good afternoon,
Sorry,
everyone.
welcome.
First of all, before you say hi,
We're the worst hosts. Welcome so much, Doc Eds.
welcome so much. Welcome, Doc Eds, to the podcast. Thanks for joining us today.
So, good afternoon, everyone. Thank you for having me,
Belle
Ava
and
and
Ava.
Belle.
Yeah.
Yes. It's called Kato Clinic because the original clinic is from Japan. It's the name of honor Dr. Osamu Kato. So,
okay.
we are a branch of the clinic in Japan, which is in Shinjuku, Japan.
And then you guys opened a branch here.
Yeah, they opened the branch here, and then all the Filipino doctors are the one who are manning the clinics.
I just want to say that Kato Clinic is quite famous amongst my friend group because 5 or 6 years ago, I've had like 4 friends who were trying to get pregnant and they all went to your clinic and they all got pregnant because of your clinic. That's why I thought to have you guys as a guest.
Oh, thank you.
Pero back then, I think 1 or 2 branches pa lang kayo because laging fully booked. I think you couldn't get
Yeah, no?
an appointment within like 3 months. It had to be ahead of that. But now, you guys have 5 branches.
No, just 3.
3.
So, actually, the first branch was in Makati. So, we opened the second branch, which is in Quezon City. It's called Kato Fertility Center, Quezon City, or Kato QC. And recently, we opened the third branch, which is in Alabang. Kato Fertility Center, Alabang, or Kato Alabang.
So you guys specialize in fertility.
Yes, that's right.
This is a hot topic now, no?
Wow, I was saying I know more friends who have a hard time getting pregnant than the natural way.
I think you're the only one I know in this like year, you and Jess,
got
who did it,
pregnant
got pregnant natural. A lot of my friends have been trying.
Yeah.
First they do like IUI and then IVF.
What's IUI?
What's IUI
It's
though?
intrauterine insemination or artificial insemination. It's when you make the female patient produce egg first, and then once the follicle is big enough, we ask the husband or the partner to come to the clinic. We get the sperm, we process it, and we put it inside the uterus.
To make an embryo.
No. You put it inside the uterus.
The girl mismo.
The uterus of the girl. So that's
Okay.
why it's called intrauterine insemination. So the sperms will still have to swim up to the fallopian tube to meet the egg. Because
Okay.
it's still natural course pa rin. Kasi the female patient will ovulate and then it will wait for the sperm in the fallopian tube.
What are the chances of her getting pregnant in that type of...
That would be around 14 to 18%. So it's
Low,
a bit
medyo
low.
low.
Kasi
Okay.
as you noticed, diba, when I explained, you just put the sperm inside the uterus.
Got it.
But the sperm will have to swim to the fallopian tube.
Oo.
So parang kasi diba sa natural conception, the sperms are deposited in the vagina. So
Yeah.
that's the difference. So this time, you put it a little higher.
So inside
Push them up.
You push them up. That's
One
why
level
it's
up.
called one level up. Yeah, I think that's the correct term. One
Pero
level
yung
up.
pinaka-high na level is yung IVF.
IVF, that's in vitro fertilization.
Before in vitro, people often try IUI first. Tama
It
ba?
depends. So, pwede kasing they go straight to IVF. It would depend on how long have they been trying, what are the factors. Kasi if both of the fallopian tube of the female patient is blocked, we cannot do intrauterine insemination.
Okay, so let's start with IUI. What is the perfect candidate for somebody to try IUI?
Younger patients and who has been trying for less number of years. And then at least they have one open fallopian tubes or patent fallopian tubes.
How do
And
you check that?
we do a HSSG. So we put a catheter inside the uterus and then we instill some dye to
Yes.
check if there's a flow in the fallopian tube. So we can therefore
Got
say
it.
that the fallopian tubes are open.
Okay.
Question, Doc. Do you test the man's sperm?
Yes, we do that. So
For IUI?
Of course, because there's a requirement also for the
them to
number of
swim.
Yeah.
What's the minimum? What's the MOQ?
Ang dami natin tanong. Let's let her finish.
It's okay.
We're gonna get on Reddit na
so for
naman.
IUI, there's the requirement. Like I said, one important would be at least one fallopian tube is open.
Okay.
And then when the patient will ovulate, it should be on that side where the fallopian tube is open. So kasi diba, we have 2 ovaries.
Tama.
And there's no pattern whether it's the right that will ovulate now and then
Iba-iba
the
ba?
left.
It's not at the same time?
No, it's just one. Once a one. So, and then, the semen analysis also, may certain requirement din. Kung super baba, we cannot do artificial insemination or IUI. We need to do in vitro fertilization instead.
What's
Kung
super
baba
baba?
ng what?
Probably, if the processed sperm, that would already be 1 million moving sperm. So,
Baba
tinicheck
na
kasi
yan?
yun. Hindi, dapat yun yung requirement for artificial insemination.
Got it.
So, if it's less than that, kunwari, it's the first time that we're seeing the patient. And then when we see the semen analysis, it's less than 1 million moving sperm. We tell them, oh, baka probably the best course is to undergo IVF already.
It seems that IVF seems to be the more effective one. Why wouldn't someone just go through IVF directly? Is it the price difference?
Because sometimes, you don't need to do IVF to get pregnant. Minsan
Okay.
nga, you don't even need to do IUI, diba?
Yeah.
So, maybe you can get pregnant on your own. Baka
Got it.
mamaya, mali lang yung timing. Maybe we just need to monitor and we just have to tell you or guide you when is the best time to have sexual intercourse.
Ah,
So,
okay.
it's not always IVF.
Okay. It's steps before
Yes.
that.
First, you encourage them to try naturally. And then after that, if after
How many months?
a year,
Actually, you need to investigate after 12 months of trying and they're not pregnant yet. So, that's the definition of infertility.
oh,
It's 12 months of not being able to conceive after regular, unprotected intercourse.
Okay, 12 months.
I think people also need to know that when you are trying to have a baby, it needs to be within your ovulation period.
Yeah, that's
Tama?
correct.
Because there are people who try na hindi pasok sa ovulation period. So, there's nagtataka sila, why am I not getting pregnant
Yes.
when the egg isn't dropping?
Okay.
Is that
so,
correct?
Yeah, that's correct. So let me talk about that. So you have to pay attention to your menstrual cycle because diba mag-start siya sa menstruation. So that's the day one of the menses would be the first day of the menstruation. So it will be followed by the follicular phase. This is when the follicle in your ovary is growing. And then up to the day that it will be released by your ovary. So that's the day of the ovulation. So, the day of the ovulation is the best time to have sexual contact when you're trying to get pregnant. And then, when the egg is released, it only has 24 hours to be fertilized. So, if it's not fertilized in 24 hours, if it does not meet the sperm in 24 hours, it will lead to the process of menstruation again. So, you get your menses in 13 to 14 days.
Wait, question. You said kasi it starts with the first day of your period.
Yeah, that's the day one.
Day one.
Yes.
So when are you ovulating? From the first day of your period? I mean, I know the answer, but I just want to know what you think.
Okay.
in my head.
So, it would depend on how long your cycle is. So, for example, diba, what is constant is that when you ovulate, in 13 to 14 days, you will get your menses. If you're a 28-day cycle, you will usually ovulate on day 14.
14,
But
tama.
that's not always the case because when you have a longer cycle, the ovulation day will come later. For example, you have a 35-day cycle. Your ovulation will fall on your day 21, di ba? It's very, parang far from that day 14. That's
Alam mo,
what
I
is
failed math
commonly
Okay.
known.
7 to the square
Di ba,
root.
35 minus
Okay.
14. Kasi di ba
Yeah.
sabi ko, in 13 to 14 days, you will get your menses.
Okay.
So you just subtract 14. And then you know that on day 21, that's the day of the ovulation. It's even harder to predict if your cycle length is parang you have a varied range. So sometimes some patients have the cycle is from 28 days to 35 days. So that would mean their ovulation day would be day 14 to day 21.
So they have that range to do it in the
Yes.
Sex.
I don't know what
Yes.
do you know what your cycle
Yeah,
is?
what-
28.
28.
But
then,
it became regular after I took the pill.
Birth
Before
control.
that, it was
Birth control really regulates your hormone. I mean your period.
It can, but then when you stop, you have to observe again. Are you
Yeah.
getting your menses regularly even after stopping the pills?
Yeah.
Kasi baka you might be just getting your menses because you're drinking the OCP or the oral contraceptive pills.
But oral contraception also has its kind of downside. Ha? Like I noticed my skin was very dry. Although my pimples were cleared. Wala lang, sharing. But I
Iba-iba.
love it. I've been like on birth control since forever.
Iba-iba
You need
siya.
to find the right one. Tama ba?
There are types of oral contraceptive pills that actually will make the female patient glow.
Oh.
Glow. As
Glow.
in better
Ako, I
skin.
think it did that for me. Side note, I just want to know, can I take birth control pills now while I'm breastfeeding? Or
You have to take the progesterone only pills.
tama, you're right.
Yeah.
Okay,
Yeah.
I remember now.
You cannot take the one with the estradiol.
Sorry.
Because
that
that's
was
bad for the baby from breast milk.
That is what we recommend, yeah. Kasi may effect din pa din siya.
Naging personal consultant
Sorry.
na natin
Going
si
back
Doc
to
Eds.
infertility.
Doc, ito na nga.
It's okay.
Okay.
Ayun nga, di ba? So, 24 hours. Imagine in one cycle, in reality, if we're just considering about the female patient, parang 24 hours lang siyang pwedeng mabuntis in one
Oo nga,
month.
there's so much pressure.
Yeah. But it can be longer because yung sperms naman can stay alive inside the female reproductive tract for 3 to 5 days. Kaya pwedeng humaba ng konti yung 24 hours na yun.
For example, a woman needs to go on a flight or something and her ovulation is going to be on Wednesday. Can they have sex Monday and then Tuesday and then Wednesday the sperm will still be there swimming, waiting for
Okay.
the egg to drop?
If you're theoretically, yes. But then like what I said earlier, if you're really trying, the best time to have the sexual intercourse should be on the day of the ovulation.
Are there any clear-cut signs that you can look for that you're ovulating?
Yung mga sa bahay lang,
Yeah. Because not everybody
I know.
has access to an ovulation kit. You know, sometimes our body tells us,
Yes,
diba?
yes. It's very hard sometimes, but sometimes
For
the,
me,
the
it's hard.
secretions can,
Secretion talaga.
yeah, yung
When a
secretions.
female gets discharged.
Yeah, not discharge. Kasi the secretions, when it's slippery,
Okay.
that's the
Di ba
time
yung
that you're
discharge?
ovulating. Yeah, discharge. Pero kasi iba-iba yung consistency eh.
Okay.
You observe your discharge during your cycle, hindi siya pare-parehas.
Doc, the
That's
way-
why it's very hard to sometimes tell the patient, you wait. Hindi na namin siya ginagawa na.
Yeah, it's
Let's
so
wait
hard.
when it's slippery kasi it's hard.
Yeah.
But you will notice that. You observe your discharge.
Funny
Iba-iba
lang how
siya.
you're like, you observe your discharge. Like, okay. Now, what are the different consistencies of your discharge that you need to take note of?
Usually, it's when it's slippery. That's
So
the time that
it's
you're
Isn't
translucent?
discharge normally slippery?
No. Sometimes they're thick.
It's
Iba talaga siya. Yung may consistency
thin.
na stretch mo pa siya. Parang ganon.
Yeah.
Okay. So,
But and then when it's thick, what does that mean?
That would mean that you're not ovulating during that time.
Oh, wow.
But when you can stretch it,
And slippery talaga, watery.
Okay.
Yun talaga
Okay.
siya. That's the time that you're ovulating.
That's when your body is telling you something, no? Like
Yeah.
our body is made so amazingly because
Yeah.
it's giving you signals.
but
You
what
just
if
need
you
to learn
don't
how
get
to look.
discharge?
Everyone does. So, maybe hindi
Parang
lang
I
natin
don't.
na-observe. Kaya nga, it's very hard. Kaya minsan, when you're trying to get pregnant and it has been 12 months already, so usually, we just monitor it.
Yeah.
Or we use the
Ovulation.
LH kit. The ovulation kit.
Yeah. So the LH kit is basically, it tests what?
It's actually the LH. Kasi di ba yung mga hormones
What does
natin.
LH again stand for?
Because we have the hormones during the menses. We have the estradiol, the progesterone produced by the ovaries. And then we also have the FSH and the LH produced by our brain. So what is being tested is actually the LH.
By
So,
the brain, produced by the brain.
Yeah. There's a feedback.
Connected. Oh.
So first, while the follicle is growing, your estradiol will go up. And then it will reach a point wherein there will be an LH surge. It will signal the brain that you will already ovulate. And then, mag-rupture na yung follicle, babagsak na ulit yung estradiol. So, yun yung mangyayari. So, the LH kit will tell you, kasi parang, mataas na yung LH kit. Kasi we know that pag umakit siya,
Oo.
pa-ovulate na siya.
That's why people, what's the word? Is it acidity or litmus test? That's what I keep thinking eh.
It sounds like a science.
The pH?
To go back, it's like a litmus test or it's testing your
pH, you said?
pH?
It's the
Yeah.
pH.
Do
Does
they
it have
do
a-
that?
Does,
We
is
don't
there,
do that.
Okay, okay. Malay ko ba? Nag-embed lang ako here.
We
That's
don't do
for-
that.
that's
Kasi
for
if you're trying to
lubricant.
get pregnant kasi, and then, kasi ang pinakaano talaga, we ask about the cycle, and then we tell you when is the best time to have sexual intercourse based on the day of the ovulation. And then if you want to be helped by the LH kit, that would also be nice. Pero mas maganda nga if you do ultrasound. Kasi
Okay.
you can really see when the follicle will grow.
Yeah, transvaginal.
That's the follicle monitoring. And then we tell you when is the best time to have sexual intercourse.
Doc Eds, can you tell us some miracle stories that the Kato Clinic has had? 10 years na sila they're trying, tapos hindi talaga, tapos biglang it happened. Do you have some of those stories?
There are a lot na...
Make us kwento some of the memorable ones,
Sige.
if you can
Let me
share
think
lang.
about
Para ma-inspire.
Yeah, because, people are struggling with infertility nowadays. Everything is so fast-paced.
And even the IVF cycle, sometimes they go through it and then it's a fail.
Yeah.
And it's so emotionally exhausting.
That can happen. So probably what we can say na lang muna would be how the prevalence of the disease para alam nila na hindi
Yeah.
sila nag-iisa.
Sige, sige.
Diba? According to the World Health Organization, the recent prevalence is around 15 to 17%. So that's around 190,000 individuals worldwide. That's about 1 in 6 women is suffering from infertility.
Wait, what did you say? What does
1
this-
in 6.
The count?
190,000.
million. Parang lit nun.
Hindi, million.
Parang
Wait lang,
ta-
napaisip tuloy ako.
Oo, million.
Pero it's 17 to 18% ano yan,
Of the
yung-
population,
the prevalence.
of the population
Yeah.
who are experiencing
So,
infertility.
That's and easier, maybe easier to would be 1 in 6 women.
1 in 6.
Yeah.
That's a
has
lot.
infertility. So it's not as uncommon as we think. Madami talagang
There is this sort of parang shame because when you're trying and then hindi pa nabubuntis, you don't want to talk about it. It's something that you feel very ashamed to be carrying,
Yeah.
diba?
Well, I mean, for that, I think it's like because you feel like your whole life you think that's what your body's naturally supposed to do, and then it doesn't happen. So feeling mo it's a fail. But now hearing so many people go through it.
And then probably para then let's talk about cycle fecundability so that those
What's
those
that?
cycle fecundability.
I can't even say it.
Yeah.
What is it?
It's the percentage or the rate of a
Okay.
sexual intercourse to result to a pregnancy. Para hindi sila sobrang ma-pressure, especially if it's just parang few months pa lang silang nagtatry.
Oo,
Kasi the
tama.
rate is only 20 to 25%. Meaning, even in a perfectly timed sexual intercourse, binantayan mo yan. You know that you were ovulating and you had sexual intercourse. The percentage of that resulting to pregnancy is only 20 to 25.
What? What's the reason for that?
That's how our body works. That's how it is. We're not super fertile compared to I
Maybe
can
in
say
the
to the
50s
animals.
or 60s. Maybe before, maybe it's
Yeah.
also the stress we have right
Or the
now.
food we eat.
Food we eat, it's more processed.
So that's how it is. And then actually, in the first 3 months, that's only about 65%. And then it will only go up to 85%. Those patients who are trying to get pregnant, 85% will get pregnant in 12 months. That's the
Got it.
reason, pag you're not pregnant yet,
Oo.
in 12 months time, then maybe you need to see a doctor.
Ah.
Kasi
Okay.
dapat 85% buntis.
Pero
pa.
doc, question. So what you're saying, you said a statistic about in 3 months if you're not pregnant. Are you referring to miscarriages? Does that
No,
happen
no.
often? Oh, okay.
That's different. Kasi when you have a miscarriage, that's still
You
pregnancy.
got pregnant. Oh, that's why they
Okay.
say, diba? How many pregnancies you have?
Yes.
How many live?
Two types kasi din yung infertility. There's the primary and the secondary. Primary, you have never been pregnant. Secondary kasi, pwedeng, even if it was a miscarriage, that's still considered a pregnancy.
But are you still considered infertile if may secondary, you've had secondary? Kasi ibig sabihin that you've been
You got
able to have
pregnant.
a baby.
But
Diba? You
if
got
it has
pregnant.
been 12
12
months,
months.
pag
That's why-
nasatisfy mo ulit yun, na kunwari, you've been trying for more than 12 months again, then it's
And then
still,
wala.
Kaya
Okay.
considered naman siya as secondary infertility.
That's what they call it, secondary infertility.
Kasi you got pregnant na before.
So at the Kato clinic, you have had people who've been trying for 10 years
Yes,
and
10
then they had a
years,
baby?
15 years, and then...
15 years?
Yeah, meron. Madami. Lahat ng numbers.
Have you had triplets?
We did.
Can you
Before.
Implant?
implant
No,
triplets?
the safest now is to only put one. That is
Okay.
what is being recommended now. But some patients, they would want to put two because they want to have twins. But of course, we would have to explain to them that if you will get pregnant and it will be twins, risk would be higher for preterm, smaller babies, and even the risk for the mother for hypertensive disorders during pregnancy. Nandun lahat yun
Preeclampsia.
diabetes.
Yeah, for
So if they're okay and they're parang
willing to take on that risk.
Yes, then we usually put 2, but we don't put 3 kasi nakakatakot siya.
Yeah.
But
I can
then,
imagine, no?
pwede kasi mag-split.
Oh.
So for
Inside?
example, we put 2 for the triplets that we had. Actually, one of
You
the
had
embryos,
triplets?
nag-split siya. It became triplets.
Wow. And then she gave birth anong month?
That-
How many weeks? 36,
Actually,
35?
she's very lucky. She reached 37 weeks. Pero that's very
Full term.
rare.
Yeah.
Usually for triplets, 32, 34.
Wow. Premature talaga.
Premature talaga.
And then you grow them in
Wow,
the
she reached
NICU.
37.
Yeah, for that patient na nag-split. Kasi we also had yung one, we put 2, nag-split again.
Do you charge extra pag triplets?
Delivery or the IVF?
Both.
No, for IVF, additional 5 to 10,000. It's just
Okay.
with
Okay,
the
not-
media of thawing and then yun lang. I think it's not that significant, diba?
Yeah.
Can you walk us through the IVF process?
Yeah.
Okay. For example, I've talked to you and then I've seen your labs and we have decided na, I think the better option would be or the better course would be in vitro fertilization. And then usually I'll ask you to come on the second day of your menses. I'll do blood tests, I'll do ultrasound. If everything is okay, I'll start giving medications. If I don't give injections, I want to say that first kasi, remember I told you only produce one egg.
Yeah.
So if we're doing IVF, usually we want to get more eggs. That's why we usually give the patient injections. So that's around 8 to 11 days of injections. So we usually monitor it during the time that we're giving the injections. So once the follicles are big enough, we schedule them for the egg harvest. So it's ultrasound guided. And then there's just a needle that passes on top of the ultrasound probe, and then we aspirate the follicular fluid
Through the vagina.
through the vagina.
Okay.
So we aspirate the follicular fluid, and then the follicular fluid will be
Suck it out.
aspirated into the test tube, diba? And then within the follicular fluid would be the eggs. So the embryologist will look for the eggs.
Is the woman awake, sedated, or what is
Okay.
it? Do they feel everything?
They can be both. So if they choose to be awake, we can just do local anesthesia. But mostly, they usually ask to be sedated.
Yeah, ako sedate
It's like
for sure.
general anesthesia then. You really go under.
It's actually just sedation. We just put
Sedation.
you to sleep.
Okay.
Parang the anesthesia will just go through the IV. We'll just put you to sleep, and then that's it. We
so you don't feel anything.
you
Walang
don't feel
pain.
anything. It's
Oh,
just a
wow.
good
That's-
sleep.
Thank God.
Very
Okay.
good sleep.
Yeah.
Yeah. And then, okay,
better.
after that, when you were able to extract it,
So we were able to find the eggs already. If they're mature, we ask the husband to collect the sperm. Then we inject or inseminate the sperm inside the egg. And then we culture it for like 5 to 7 days.
this is outside the body, right?
Outside
So
the body.
In a test tube.
That's why it's called in vitro fertilization. It's outside the body fertilization.
Yes.
Okay, that's what
That's
it
that.
means.
The guy
kaya
just
siya
has such an
IVF.
easy time.
I know. I mean,
He gets to watch
pleasurable
pa, whatever.
time.
Okay, choose your video that you want to watch.
Yeah, that's right.
Okay.
But how come you know that?
Wala, it's watching movies.
Alam na alam.
Okay.
But Doc, diba, it all has to be in the context of a marriage. Is that what I know? Like they have to be
yes,
married
because
to
has
do
to
that?
be husband and wife. They have to be partners.
So what about their like long-time partners but they want to get married?
Especially in the Philippines, kasi we don't do third-party IVF. We cannot use donor sperm, donor egg, or do surrogacy in the Philippines.
It's against the law.
To be technical, it's not in the law. I mean, it's not
It's
part
not
of our
in the
law.
law,
We don't
okay.
have ART bill right now. But then there's a body that's governing all the IVF centers in the Philippines, and then that's the ethical recommendation or practice. We cannot do third-party IVF for now.
For now. Is that
For
something
now.
that's being ano?
It's a hot topic.
I'm
I can say
interested. I
that.
mean, I would like for it to be like for other people to be able to get.
We're not there yet. But
Yeah, we're
like
not
for
there
example, in I think it was Australia or I think in
Yeah.
France, like once you've been together, Netherlands pala, it's like common law.
Yeah,
husband
common
or
law.
common law.
Australia's
They
like that.
don't get married anymore.
Yeah.
Because people are nowadays, the younger generation, they don't get married. They're just like they have a baby not together.
Yeah.
And
They don't wanna
IVF
enter the
abroad is
contract.
covered by medical insurance.
Yeah, I heard, right?
That's right.
Is it
that
here?
something gonna be
In the Philippines, it's not covered by medical insurance, not even by PhilHealth, because we don't have a law. Probably, if we will be having that ART bill soon, that will be the things that could change.
who's pushing that ART bill here? No one. Or someone.
There is the Philippine Society for Reproductive Medicine. We
pushing
are
it.
for it. The ART bill first. Kasi
I'm gonna look
without
at that.
it, magulo eh. Even the third-party IVF, it's very messy.
Okay, so you have to be married. That's one clause. After you do the fertilization outside the body, how many days before
You put it
you
back.
put it back?
So it would depend on the protocol that the center would be using. But for us, when we get the embryos, we usually freeze them first, and then we put it back the following month.
Why? Why do you have to freeze
We
it?
have to freeze them kasi with the medications that we're giving, they're not good for the endometrium. That's why we want the next cycle. It's a better cycle.
Oh, so you
But
also
there
have to
are
make it.
patients there are centers who does fresh transfer.
So you make it also timing with the female body.
Yes, we remove it on the day of ovulation, and then we grew it in the laboratory for 5 days, right? So when we put it back, it's usually 5 days after ovulation. Kasi dapat
Sync.
Sync
Yeah.
sila.
It can't be like
You just put
you
it
know,
back whenever.
whenever.
randomly.
No, kasi tama nga naman. I never thought of
You
that.
cannot.
Makes
So
sense.
that's why even during the embryo transfer, we usually monitor the patient when the ovulation is, and then once we know, we schedule the embryo transfer because that's the window of implantation.
And what about the embryo transfer? You said you grow it, meaning I don't know. Is it growing? Is it it's a
Cultured
blastocyst?
culture.
You
Yeah, to
culture it
blastocyst, yeah.
blastocyst.
in like a room controlled temperature.
It's
Paano
in
kung
an
nag-black out?
incubator.
Ay, oo nga. What happened?
Dito to.
Na, that's a valid question.
Yeah.
In an incubator, kaya kailangan yung laboratory, dapat may provisions for that. Hindi pwedeng mag-blackout.
So it has to have backup electricity.
Yes, may
Okay.
generator, basta
Got
may
it.
provisions. Kasi hindi pwede.
Hindi pwede
Kasi-
magka-IVF clinic sa Siargao kasi laging blackout doon.
Tama. Solar. They can do solar. Pwede
No,
ba yun?
kasi it's not enough when it's a freezer. I was there in
Different
Siargao.
than yung freezer, ah.
Yeah.
Kasi yung freezer, hindi yun electricity.
Okay.
Kasi for freezing, it's nitrogen.
Nitrogen.
Yeah, it's just in a tank with nitrogen.
I'm learning so much.
Yeah.
But for the culturing, You need electricity kasi
Okay.
it has to be in an incubator.
Okay, so when it's finally the embryo is ready, you're gonna insert it back into the female's.
Yeah.
Is it through just an injection or is it a whole big?
Do they have to be sedated again?
No. Kasi the process is just like artificial insemination where you just put a small catheter and then you can push the embryo.
Okay.
And it's
It
also
goes straight na?
Yes.
Got it.
Guided by ultrasound para
Oo,
mas
tama.
precise yung placement.
Wow, so you can precisely place the embryo.
Yes, inside the uterus, yes.
Wow.
Do you have a percentage of how?
Pregnancy rate for
Yeah,
IVF.
for
yeah.
IVF.
So yeah, even with IVF, diba, you culture it outside the body, it's already alive when you put it back. But up to this point, pregnancy rate is only about 50%. That's
50.
50. That's across all ages, ha. But if you're gonna consider then yung ages, when you're more than 40 years old, it can be lower. It can be around 35% or 40% lang.
What's the reason for that? Is it the quality of egg? Okay, also.
Okay, yeah. Kasi when we were born, all the eggs that we will ever have are born with us, kumbaga.
Okay.
And then as we grow older, yung quality and the quantity of our eggs kumukonti or
Oo, tama.
they decrease, di ba? Not only the quantity, even the quality. And that's evident actually, lalo na yan pag after the age of 34, at 35, drastic yung pagbagsak ng pregnancy rate and pag-increase ng miscarriage rate.
Okay.
And that's because sobrang bilis na nung pagbagsak nung quantity and the quality of the eggs.
That's why they say you should freeze your eggs at what age?
Ideally, that's around 35 to 38 years old.
Because at 35, you're considered geriatric na nga with the pregnancy, diba?
Wag naman geriatric, but we
high
usually,
risk, diba?
we usually consider it high-risk pregnancy, yes, at 35. Kasi madami nang pwedeng complications such as, hypertension, diabetes, nandiyan na yung mga yun eh.
I'm just in awe that you guys are able to use the ultrasound to be able to implant the embryo exactly in the uterus, where in the uterus. Kasi where you implant, that's where the baby's gonna grow.
Yes, that's right.
Tama ba?
That's correct.
And you can put it in a safe place because sometimes, I have like a big scar in my uterus because of my cesarean. So,
So usually the scar naman, it's outside.
okay.
So when you do that, you advise them not to move? Is that the thing? Like, do you have to
Bed
be
rest.
bed rest?
No, usually, after the embryo transfer, we usually advise patients to stay at home, but not actually bed rest.
How many weeks before you know if the pregnancy?
After a week, we know.
What?
We
We
ask the
know
patient to
na.
come back after a week.
And then?
We do a pregnancy test, and then we know whether the patient is pregnant or not.
Why? How, you can tell right away the
HCG.
HCG
Yeah,
levels
the
are high.
HCG. Yeah. There's a level.
So
already.
after 1 week of implantation, you know that they're pregnant. And then, tuloy-tuloy na yun, right?
No.
Oh, you have to wait
we will
12
have
weeks.
to monitor. Kasi parang, usually, in our clinic,
Oo.
we usually monitor the patients every week until we see a heartbeat. Kasi
yeah.
anything can happen.
Yeah, of course.
Yes, that's
course.
why we want to monitor it very.
May refund ba if something happens?
No, unfortunately, wala
Not here,
eh.
diba?
Not here.
In Spain, they do it, but
Art talaga?
why can they do that in Spain? Like
The
are
refund?
They
If-
guarantee.
They refund your not for the medicine, but for the service.
Okay.
Parang basta you get money back or something like that.
Okay, but we have something. We have a package or a protocol in our Kato clinics.
Yeah.
It's a success-based plan IVF. May certain age yan. That's for patients who are less than 38 years old. But di ba, remember what I told you? We usually give injections for you will have more follicles. For the success-based plan kasi, we just use oral medications.
Okay.
And then we get the eggs that will grow from it. So sometimes 1 or 2. We have a protocol where instead of giving injections, we just give oral medications, clomiphene citrate, and then usually 1 to 2 eggs will grow.
Okay.
And then we will, same process, we'll get those eggs, we'll culture them, IVF, same, and then we put it back. And then may certain amount ka lang nababayaran. So when we put it back, hindi mo siya babayaran yung full amount. And then, if magka-heartbeat na yung baby mo, that's the time that there's
you
a
pay
certain...
the full amount.
Yeah.
Almost like a guarantee, something like
We
that.
don't want to say guaranteed eh. Kaya that's why
No,
we
parang-
called it success-based plan. So if you're successful and there's a heartbeat, that's the time that you pay the
Yes.
full amount.
I like that. I think that's very considerate. Kasi the last thing is you pay so much tapos hindi. And
Let's
then
ask first how much it is.
Kato clinics usually do minimal stimulation IVF. So
Okay.
usually we ask patient to prepare around 450,000.
That's for IVF.
That's for IVF.
But if you come in and say, I want to do a consultation.
First consultation, that's around around 1,800 and
Okay.
succeeding consultations would just be around 900 for our Kato clinics.
And then if you do IUI,
For IUI, the process itself, it's 13,500. But then,
1,300.
1,300, 13,500. Pero, syempre, may monitoring, the ultrasound, the
Gets.
medications.
Yeah.
Yun.
Then you pay on top of that na lang. Kung
Yes.
ganun. Got it.
So, the 13,500 would just be the intrauterine insemination.
For IVF though, at 450, is this already the cap or will it
No,
can it
that's-
only go higher?
That's actually the average. So, when
Average.
we're saying that, yun yung tinitingnan namin average na-spend ng patients.
Got it. And that includes their medicine na.
Medicines, everything.
How
Actually, it's
how
included
long
there.
do they prepare for this? Like their body? Because I remember my friends had to prepare their bodies.
Yeah. Usually kasi the process itself, 2 months siya, diba? First month would be getting the egg, and then second month would be putting it back.
Got it.
2-month process. So kailangan you're in the country for 2 months. You don't travel
Kasi
really.
during the first month, parang 2 weeks lang siya. So we have patients kasi traveling eh.
In between,
In between. So after we get the eggs, they can go back to their country. And then, di ba sabi ko, we do the transfer. We have to monitor when your ovulation is. And then, once we know the ovulation, we know when the transfer. So, yung monitoring na yun, sometimes, if we can coordinate it, and you can have the ultrasound done wherever you are, we can do that. And then, just tell you to come pag malapit. That's not necessary na you have to be here for 2 months.
What about when it comes to your weight and the food that you eat?
Okay.
Is that something that plays a factor into your fertility, or if you are doing IUI and IVF?
Yes, it's always a factor. And it's always
Yes.
good to lose weight. It's always good to eat healthy. There are a lot of studies on obesity. So they compared patients who are on the heavier side or who are obese compared to those who are not obese or normal weight. They saw na those on the heavier side would require more injections.
Okay.
And even if they required more injections, it's the number of eggs are significant that they were able to get parang are significantly lower compared to those who with the normal Kaya we still advise to lose weight.
Stay fit.
But what about if you're super duper skinny? Because now naman, because of, GLP-1, there are a lot of people who are extremely underweight and skinny. Is that also a factor in
Yes,
getting
it's also
pregnant?
a factor.
Really?
Kaya nga we want it parang the BMI should be 20 to 25.
That's my BMI.
Talaga?
No, so if you're a woman,
Wow.
no, but the
Just
point is,
kidding.
if you're a woman and you are on GLP-1 or you're on Ozempic or Mounjaro or whatever it is because you want to look really good, you're skinny, but your body mass index is below 20%, you can test for that. Let's say sabihin mo it's 16. You look amazing. Your arms are really toned and your cheekbones are all.
Doesn't necessarily.
It's
mean-
actually
Parang 16, sobrang nun.
it's like a guy's. Okay, sabihin mo na 19, 18 or 19% body fat index.
Body mass index.
What
yeah.
you're saying is that it's science-based facts.
Yeah,
That it's
it's
also
ideal
harder
to,
for a very skinny person to get pregnant.
Everything should be in moderate. Between 20 to 25, that would be ideal.
20 to
Okay.
25%.
Actually, 25 nga. It's not percent kasi eh. That's kilograms per meter squared. You will compute for that.
I keep
Their own-
putting what's the metric?
Kilograms per meter squared. Yeah. Kasi you'll get your weight in kilograms and then you divide it by your height in meter squared. So you multiply yung 1.62 times 1.62.
God.
Okay, i-chat
So, parang-
GPT nyo na lang yung sagot. Para alam nyo.
God,
Diba?
pinamana
Totoo.
mo
Yeah,
tayo.
you can. You can actually compute for my BMI.
Okay, going back to my question, I've seen a lot of things surface on the internet about how egg freezing isn't exactly the answer. People who feel discouraged, people who are like, I don't want to
Gawin
try.
ko ba to or what?
Yeah.
On
What are some tips that you, or encouragement maybe that you want to tell people who,
For those who have been trying for more than a year already, don't hesitate to go to us. Talk to us. We're here for you. We have 3 clinics now. 1 in Quezon City, 1 in Makati, 1 in Alabang. So we can talk first. It's not always na when you come to us, it's gonna be IVF already. It's gonna be IUI already.
So for those of you listening to the Sexytime podcast, if you guys have been struggling with infertility, you've been trying for more than a year, and you don't know where to go, what resource, the Kato Clinic is here for you. And because you are our loyal listener, they are going to give you a free consultation one time. What does that include, Doc?
It would be consultation with our infertility specialist, and then we would be discussing about your problem, and then we'll be giving you the options.
Perfect. And then the next step would be, kunyari, to take blood work.
Depende kung what's the plan for them.
Okay. That's amazing.
Thank you so much for giving our listener. Thank you for allowing us to force you.
Yeah.
No, it's okay.
She's like, oh my gosh,
Ano
hindi
ba
ko na
to?
mahihit ang quota ko. Kato Clinic is also giving a teleconsult, which means if you're abroad, if you're in Melbourne, if you're in Sydney, or I don't
Or
know.
even
The
from
States.
Visayas, Mindanao.
Yeah.
Okay.
You guys can schedule an online free consult. All you have to do is say the Sexytime podcast. So this promo is gonna land from September 22 until October 22. So if I were you guys, Doc Eds, where can they find you online?
Check our website. It's conceiveivf.ph, or our Instagram account and Facebook account would be Kato Fertility Center QC.
Kato.
Yes.
Thank you so much, Doc.
Thank you, Doc Eds.
Thank
We learned
you.
so much.
Oh, wait. Before that, we have something for you. For you
yeah.
talaga, for the team to share. This is a little jolly time gift for you.
They're
Yes.
actually excited.
We'll give you guys, and how many nurses do you have? We'll find out, and then we'll send you guys a clinic.
Thank you
Thank
so
you.
much.
Thank you for having us.
Thank you.